I'm Ben Stronach. I'm an associate professor at UAMS and have been here since January of 2021. I'm an orthopedic surgeon, and specifically my focus is in hip and knee replacement and revision hip and knee replacement surgery. In the clinic, we see lots of patients with arthritis or patients that have had problems with the hip or knee replacement that we're trying to figure out the cause of and if they need further treatment. In surgery, we typically are doing hip and knee replacements for patients with specific conditions where their joint is worn out, and we also will redo certain types of joint replacements that are having issues and causing problems for patients. I think it's very important to involve the patient in any decision-making process. And the first step of that is to educate the patient on what their specific problem is and then present them with their options. In general, I try to look at that patient and think about what I would do if I were in their situation, if the patient was my mother, my brother, or a family member. So I've had an interesting journey that led me to my current role here at UAMS. When I finished my training, I first went to the University of Mississippi Medical Center in Jackson, Mississippi for almost 10 years. I was an arthroplasty surgeon there as I am here and was in a much different role where I was the only academic surgeon serving the entire state, and I gained a significant amount of experience in that process. I came to UAMS through a relationship with Dr. Lowry Barnes, who's the chairman of our department.
Dr. Stronach and I have known each other for 8 or 9 years. He was at University of Mississippi, where he was chief of total joints there. We're in some national organizations together and have gotten to be friends and maybe somewhat of a mentor-mentee relationship. When we realized we need another person here to increase the size of our team, he was interested in coming here, and we could not have been more excited. He is a great addition to the team. For us, hip and knee replacement surgeons, it's all about taking away pain and increasing function. And so that's our goal. How can we best meet the needs of our patients and get them back to doing the things they want to do? But if you talk about what makes a great academic orthopedic surgeon, that's even more significant from having Dr. Stronach come here, because that means not just taking care of patients, but educating residents and students, as well as peers here and around the country, and also doing research.
My favorite part of being here has been the camaraderie, being able to work with other surgeons who are passionate about hip and knee replacement, such as I am. That's been extremely rewarding and has been a major benefit in my transition to coming to UAMS.
What makes me smile knowing that I'm going to see Dr. Stronach that day? I know that it's always going to be, one, intellectually stimulating because he's so smart and he asks great questions, but I also know it's going to be entertaining because he's a normal guy who likes to have fun, likes to pick it at us and us at him, because we have a group that gets along very well. We're all friends and we love challenging each other and making fun of each other. And it took Ben no time to become part of the gang doing that. And so he fits in perfectly here.